Hi, are you someone who's suffering from a chronic sinus problem, a chronic runny nose, a chronic postnasal drip? Are you having to resort to going through boxes and boxes of tissues because your nose just doesn't stop? Do you feel like you're allergic to something in the environment, but you haven't figured it out yet? Maybe a doctor told you that you're allergic to dust. Maybe you're allergic to pollen. Even if it is pollen, but it's wintertime and you still have your sinus problem or your runny nose or sneezing problem. Maybe you've been allergic to cat hair. Maybe you don't have a cat anymore, but you still feel like you do have the allergy still. Listen, my name is Dr. Lonnie Herman, and I've got a very successful method of finding why you really have the chronic sinus or chronic nasal problem, the chronic postnasal drip, the chronic sneezing, the chronic congestion, and the need to constantly use tissues. I've got various proof here on my website and on my YouTube channel that I'll share with you as well in just a moment. But first, we're going to talk about this young man, 13 years old. His name is Mario. I actually met him. I was working in some real estate venture, and I met his mother, who is a realtor. And a very nice and lovely woman. You'll hear her voice in the video I'm going to share with you of his testimonial. He was kind of a little shy at the camera, and maybe she was too, but you'll hear her voice in the background as she's describing of what it was like for her to watch her son living constantly going through tissues, constantly going through rolls of toilet paper because his sinuses were terribly congested. He was constantly blowing his nose, and now no more. So I've got a very successful way of helping a person treat the reasons why. It's not that you're allergic to dust. It's not that you're allergic, as they say, quote unquote, to cat hair or pollen. It's that you have deeply hidden, embedded infections in your sinuses, in your nose, in your lungs, in your lymph, in your brain, in your stomach. They could be anywhere in your body, leading to a chronic sinus congestion, a chronic runny nose or postnasal drip, or chronic congestion in the sinuses, which could even lead to a headache or chronic sneezing, which I'll tell you, there's a video here that I have. I just want to quickly reference this one. This woman was sneezing 200 times a day. 200 sneezes a day, every day. And those all stopped with my work. And you could hear her testimonial as well. It's amazing. It's life-changing, life-saving work that we're doing here. So let's hear for a moment what Mario has to say. It'll be very brief, and even hear a little bit of what his mother has to say. It'll be very brief, and then I'm going to come back in just a moment, and I'm going to share with you the unique exam findings, what we treated in him that was there that no physician ever found, what we treated in him, as well as I'll make you a free offer near the end, and then tell you how you can become a patient here in my clinic. All right? I'll be back in just a moment. You have had this, was sinus and or nose congestion for how long before we met, June of 2022?
All my life, actually, every day. The sneezing and the stuffy nose, every day of my life.
At least 10 years or so you've been dealing with that.
It's very disheartening, for your child to constantly be stuffy and sick and blowing their nose and uncomfortable because you don't know what to do to relieve it. We've done sinus rinses, a couple times a day. We've done the nasal spray. We've done the 𝐊𝐄𝐘𝐒, Allegra. From time to time, he might get like a slight infection and he would have to go on antibiotics.
Usually we get the 6-pack of tissue boxes, and we usually run out of those, or expect to run out of those at the very least.
Run out of those how quickly? 6-pack?
By the end of the week.
Now that it's been more than 6 months since I saw you, how quickly into the protocol did you notice the relief?
I would say I first started noticing that I wouldn't need to blow my nose every 3 seconds. That's an exaggeration, but every 3 seconds. After like 2 weeks. 2 weeks, I'd say.
Since you completed the protocol brought complete relief from the sinus and nasal congestion issue?
It has. I haven't had to just blow my nose every night anymore. I don't need to do any of that stuff. My nose isn't stuffy every night. If I'm blowing my nose, it's because I'm actually sick, not because of some stuff.
Okay. So sometimes the sickness can happen, but still it's not that chronic sinus nasal problem that you've had for your whole life.
Yes. And I'm nowhere near I don't get sick as often as I used to before.
For him, with him getting sick, any little thing would trigger him to be sick. He started to get sick at one time because his little brother was sick, but he like literally, it's like his immune system just started to kick in, and the next day he was fine. I was very pleased with that.
So you were done with that protocol probably by, let's say, late July of last year, maybe August, beginning of August of 2022. And since then, you have not had the relapse of those sinus symptoms.
Since then, I have not.
Is there anything else that you want to tell anybody, or are you just happy? We're happy that we're free of this.
I'm just happy. I'm just happy.
Awesome.
He's so much better. So it's very exciting. And we would like to thank you.
You're welcome. Thank you.
I was so proud of him because he was determined to do it. He had his schedule down packed. I would just say to him, did you do it? And he'd say, yes, I did it. As the time kind of went by and I was like, I'm not buying Kleenex like how I used to. Kleenex was always on the grocery list. So, and then of course, there's also the toilet paper. He didn't mention that part. Notice little things like that. Like I'm not having to purchase Kleenex as much or, toilet paper as much. And I'm not hearing him coughing in the middle of the night and blowing his nose. Like he can actually get sound sleep. I go and just out of habit, I get up in the middle of the night and kind of check on him. And a lot of times he would be up coughing or blowing his nose. I'd see all the tissue kind of piled up. And I'd feel so bad for him. But now it's like I go in there and he's sound asleep peacefully. So I'm very excited about that. I'm also excited at some point get myself and my younger son in, to look at our system and to see what you can find. Yeah.
Those root causes are commonly missed. And I'm just going to share this online. I'm going to make another video that you all who are watching this can flip to in just a moment. You're going to hear the findings of what I discovered with him that had been lurking in his lungs and in his sinuses for many years that his doctors had never found. And it wasn't that, again, an allergy of dust or an allergy to pollen or an allergy to something else that was a cat or a dog. It was that there were hidden infections and toxins that had been in the respiratory system, including, but not limited to, his sinuses and his lungs. That's what caused those infections and toxins, caused his chronic sinus congestion and the coughing and the runny nose for all the years of his life, all of them up until now. And when we can find those and get rid of them, the symptoms just disappear like they never existed. So isn't it incredible? His mother doesn't have to buy all the tissues anymore. She noticed that they just stopped appearing around the house. He doesn't need to blow his nose so much. He doesn't have the sinus problem that he had for a long time. And I'm proud to say that with my work, which is the reason why this all stopped, without medication. So let me tell you what I found in the unique exam process I did with him that helped him finally find relief from the chronic nasal sinus problem. Number one, the sphenoid sinus cavity. Sphenoid sinus, we'll show you a picture right here. There's a sinus that's actually behind the nose in the skull. That sphenoid sinus actually had contamination from various vaccines that he had years ago as a little boy. The sphenoid sinus also was infected with the influenza virus. His sphenoid sinus was infected with the Epstein-Barr virus. His maxillary sinus, the sinus that's above the upper teeth in this, what's called maxillary bone, the maxillary sinus that runs from the front teeth all the way to the molars, the maxillary sinus was loaded with multiple different bacteria. His frontal sinus was loaded with multiple different bacteria. His sphenoid sinus, again, was loaded with multiple different mycotoxins or mold toxins, mold infections as well, and dental anesthesia chemicals that were injected for a procedure he had done years ago. Was those chemicals were also causing your sinuses to feel swollen all the time. Well, listen, when they inject you in the mouth to numb a tooth, say to fill a cavity or pull a tooth, where does that numbing chemical go? When it wears off 3 hours, 4 hours, 5 hours later, where did the chemical go? Did it just, because you can feel your mouth, you can speak normally and swallow normally, and you feel there's no numbness in your face anymore, where did that numbing chemical move to? Did it just leave the body because the numbness wore off? Or did it move somewhere and cause you another symptom and you don't realize the connection? I found with him in his sphenoid sinus was a dental anesthetic called Procaine, affecting his sphenoid sinus for who knows how many years. Okay, so that can happen to you too. It's interesting. I went to the dentist I use. It was about a year ago. I had to get a tooth pulled. When he injected my mouth to numb my mouth to pull this tooth, I couldn't breathe. I went in breathing fine. My sinuses are not congested. They were not congested when I went to his clinic. Yet once he numbed my mouth, my sinuses became congested. I couldn't breathe through my nose anymore. I realized something in that moment. Dental anesthetics can be in the sinus cavity of a person with a chronic sinus nasal problem. I found that he also had activated mast cells affecting his sphenoid sinus. Activated mast cells, I talk about a condition in a video called mast cell activation syndrome. You can click on this link, you'll see the video here, and watch that video. I get into greater detail about these activated mast cells. I'll give you a brief introduction. We have cells called mast, M-A-S-T, mast cells, and they become activated by certain things in our environment. When they become activated, they become traitors to the body. They release inflammatory substances into the tissues of the body, and we can neutralize them with these safe and highly effective quantum energized formulas. Also, I found that he had strep pneumonia bacteria affecting his whole entire skull. He had the strep in his lungs. He had viral infection and mold and yeast infections in his spleen. His lungs had the measles virus. His trachea, the windpipe, if you will, from the nose and mouth down to the lungs. His trachea had the measles and the Epstein-Barr virus. His lungs, the influenza and the Epstein-Barr virus. His lungs also had contamination from old tetanus shot that was in him. This is everything I found with him. His protocol was about 42 days in length. That was it. He followed his protocol at home. We provided him these safe and highly effective quantum energized formulas. His body was able to target these infections and chemicals in the tissues that we discovered these infections and chemicals in. Once he took those, the infections were eliminated, the toxins were eliminated from those tissues and expelled from the body, and he doesn't have the symptom anymore. Quite remarkable. It can happen for you too. We have more than one, more than two, more than just a few patients. This is not lucky. This is real scientific work based on biophysics research. I talk about it in my ebook that's on my website. That's free for you to download. So go to my website at drlonnieherman.com and download your free copy of my ebook about how you can rapidly alleviate symptoms from chronic illnesses with quantum energized medicine. And in my rapid health restoration system that I've developed, I figured out over the years, ways to find these different infections and chemicals in specific tissues in the body. And no, there's nothing invasive. There's no cutting. There's nothing invasive that we have to do here. This is all a very unique process. Now, in my book, the free book that you download, there are 3 different links, and it might only take you maybe an hour to read that book. All right, just maybe an hour. There's big pictures, there's big font. It's easy for you to read and understand. There's no doctor jargon that's going to make you confused when you're reading the book. All right, so it's very simple to read. There are 3 links in my book. 1 is about my unique food testing. 2 is about dental analysis that I perform in my clinic, where I found teeth connected to infections in the brain and the body and the sinuses from the teeth. 3, there is a link on the very last page that takes you to a private page on my website. That private page is only private because I want you to read the book first before you go to this page. So on the end of the ebook, click the link and it takes you to another video, 42-minute video, where I talk about, for the first about 20 minutes, my journey as a physician, become the doctor who can help you get better. My journey as a physician to figure out what was going to work and what didn't work. So even in functional medicine methods and other types of strategies that weren't working, I figured out that certain labs were useless and certain other methods of, if we can say, treatment were not as effective as I hoped they were going to be, until I found what is effective, which is what I'm doing now. So I get into also in the second half of the video, a brief insight to my method of testing. But back to the ebook, before I talked about, one of the pages I talked about is the food analysis. So that is really important because there are different environmental stressors as well that you may be irritated by that you don't realize is irritating you. For example, Windex, window cleaner, a toilet bowl cleaner, perfume, an essential oil, some things that you're using that you don't even realize. And I get more into it when I get to speak with you one-on-one in a very professional consultation appointment, where we're going to pre-diagnose some of the possible links to what's causing your chronic sinus or chronic nasal problem or respiratory problem. So again, download your free copy of my book, read through it. It's very easy. I look forward to helping you get better. So it's important that you become a bit educated, because this is looking at your body and your sinus condition or nasal condition from a whole different viewpoint. It's not, even if you've been to an eye, ear, nose, throat doctor and you've had medical tests done and you've had them put a scope up your nose, there are things that these different methods that these doctors use that may miss the reason or reasons why you are suffering with your chronic nasal problem. All right. So look through all that information, start to understand from a different way of looking at things. And then when we have our first pre-examination diagnostic consultation appointment, I will ask you specific questions that most likely other doctors maybe have asked you, but most likely haven't asked you or haven't posed to you. And so it's going to give me a greater insight as to what I need to do to figure out what's going on in your body when I do meet with you for your in-person examination here. Okay. Now, this type of work will be an investment in yourself. This type of treatment will be an investment in yourself. Insurance companies might recognize certain things that's on the policy that you have with them, but they don't recognize this work. So it will be an investment in yourself. You can get better. It will be an investment in yourself. If you go to the FAQ, or frequently asked questions page on my website, you will see that there are certain questions that people commonly ask here, one of which is, what does it cost? This is only a fraction of what we're going to give you and help you get your life back and stop the misery of the chronic nasal or sinus problem. It can be over for you. And I've done it for many other people. The time is now for you to become a patient here and have me help you overcome your condition. I look forward to helping you. You can make an appointment in my clinic at 954-370-3100. That's 954-370-3100. Or you can email my clinic at clinic@drlonnieherman.com. That's clinic@drlonnieherman.com. Or you can easily book your appointment right on my website. It's very easy to do. And when you go to the book appointment page on my website, it takes you through, we explain everything in such simple detail for you to be able to just handle it right there on my website. If that's too much for you to do, call up my clinic or email my clinic and we'll be happy to help you, or my assistant will be happy to help you set up your appointment. I look forward to helping you and turning you into one of these great success stories too. I will see you soon. Hi, I'm Dr. Herman, and I'm here with a great patient. This is Mario. Mario had come to my clinic back in June of 2022. Right now we're in January of 2023, and already about 6 months after treatment, he is still having some incredible, the results have been incredible, and they've been sustained. And what we're going to talk about now is that Mario had lived for a pretty long time with chronic sinus congestion and nasal congestion that was pretty annoying for him and his mother to see what he was going through with the sinus problem. So if I could ask you, Mario, you have had this, was sinus and or nose congestion for how long before we met June of 2022? How long were you dealing with that symptom for?
All my life, actually, every day. The sneezing and the stuffy nose, every day of my life.
And how old are you now?
I'm 14 years old.
So every day, so as far back as you can remember.
Yes.
So we're talking, so at least 10 years or so you've been dealing with that. And your stuffy nose and runny nose, was it every single day and all night? Or was there a time where you noticed that there was a relief of the symptom on and off of the symptom? Was it constant or on and off?
It was every single day and every single night, but it would happen near the end of the day, or the start of the day, and at the end of the night. Before we met, what did you do as a treatment for it? Were there nasal sprays? Were there steroids? Did you have allergy pills? What did you try before? I had like allergy pills, like things like like Zyrtec and stuff.
Did those ever provide you relief and help you reduce the kind of stress in your nose and your sinus?
It worked sometimes. It wasn't consistently working, I would say.
So sometimes you could take one of these allergy pills and you would feel some relief in your nose and sinus, and sometimes you take the pill and you would not feel relief. Is that what you're saying to me?
Yes, but when I did take the pills, I'd feel like little relief. Like it wouldn't.
Not 100%.
Yeah, I wouldn't be 100%.
Okay. And besides those allergy pills, were there any kind of nose doctors that you saw? Was there any other physician that you saw, or was it just trying the over-the-counter meds and constantly blowing your nose?
It was like allergy professional.
Allergy doctors. Got it. And did they have any other recommendation that they provided you? Was there any other treatment that they did that ever provided you relief besides taking an allergy type of pill?
All I really had was the nasal rinse, but other than that, it would always be back to square one after a little while.
And how long was a little while when you used the nasal rinse that it cleared up? Was it just a day? Was it a few days you felt relief from a nasal rinse type of procedure? Or was it just a few hours and it came back?
Usually be over the next day or the next couple of days.
Got it. And so I know when I met with your mother, she was telling me that it was constantly in your bedroom and other places. There were tissues everywhere, right?
Yes.
And that was a constant thing. And I think she even mentioned to me before I got to examine you that maybe she had like an air filter in the room, perhaps, she was trying to help like cleanse the air. So maybe that could help you.
It was a humidifier, yes.
Humidifier. And did that humidifier ever relieve any of the stress in your nose or your sinus?
Well, no, it did. It did not.
It did. And so how many boxes of tissues were you going through each week? Did you ever count?
We ran out. We usually would get the 6-pack of tissue boxes, and we usually run out of those, or expect to run out of those at the very least.
Run out of those how quickly? 6-pack?
By the end of the week.
Yeah. Wow. So now that it's been more than 6 months since I saw you, how quickly do you remember when you started that protocol, the only one protocol that we've done for your sinus, how quickly into that protocol, if you can recall now, we're going 6 months ago, how quickly into the protocol did you notice the relief from the sinus condition, where you didn't need all those tissues anymore or the allergy pills?
Well, I would say it didn't all happen at once. It definitely happened over time. Like it started getting, like the effects of the valve started showing more and more over time. But I would say I first started noticing that I wouldn't need to blow my nose every 3 seconds. That's an exaggeration, but every 3 seconds. After like 2 weeks. 2 weeks, I'd say.
Mm-hmm. And so since you completed the protocol, has there been any and it's complete relief? First of all, the protocol brought complete relief from the sinus and nasal congestion issue?
It has. I haven't had to blow my nose. I haven't had to just blow my nose every night anymore. I don't need to do any of that stuff. My nose isn't stuffy every night. If I'm blowing my nose, it's because I'm actually sick, not because of some sinus.
Okay. So sometimes the sickness can happen, but still it's not that chronic sinus nasal problem that you've had for your whole life.
Yes, and I'm nowhere near. I don't get sick as often as I used to before.
That's great. And so you've been through so many months now since we treated you, because you followed a protocol that was about a month and a half in length. So you were done with that protocol probably by, let's say, late July of last year, maybe beginning of August of 2022. And since then, you have not had the relapse of those sinus symptoms. Since
then, I have not.
Yeah.
Well, between those 2 weeks where I said I started to notice the difference myself,
Mm-hmm.
It happened in those 2 weeks. But after those 2 weeks, I was way better than what I was before.
Pretty awesome. So we're happy that you did it. We're happy you got a chance to do this with you and work for you and help you get better. And with your permission and with your mother's permission, I'll be able to produce another video with the kind of exam findings that I discovered of what we treated in you that provided the relief for your symptoms so quickly and provided you relief, sustained relief from a lifetime of that chronic problem. If that's okay with you, that I share that.
That would be great.
Yeah. All right. Thank you. Is there anything else that you want to tell anybody, or are you just happy? We're happy that we're free of this.
I'm just happy.
Awesome. Thank you for your.
Dr. Herman?
Yeah.
Can you hear me?
Yes.
Can I say something?
Please do. Come on in.
Well, I won't come in visually, but I just want to say it's for him, with him getting sick, any little thing would trigger him to be sick. And we went throughout the whole Christmas break, and he was not sick. He started to get sick at one time because his little brother was sick, but he like literally, it's like his immune system just started to kick in, and the next day he was fine. I was very pleased with that. It's very disheartening, for your child to constantly be stuffy and sick and blowing their nose and uncomfortable because you don't know what to do to relieve it. We've done sinus rinses, a couple times a day. We've done the nasal spray. We've done the 𝐊𝐇𝐿𝐒 Allegra. From time to time, he might get like a slight infection and he would have to go on antibiotics, that kind of thing. And he has, he's so much better. So it's very exciting. And we would like to thank you.
You're welcome. Thank you. I remember when I got to meet with you the first time and I told you what I thought it was. So it's awesome that we got a chance to do this together for him and for you, because then it was troublesome for you to watch him and see how he was suffering constantly and the tissues and the bad tissues everywhere in the house. So I remember what you told me about that. So it's pretty awesome to see this so quickly go away and stay that way, which is great. We get rid of the cause that had been there for however many years, get rid of the cause that constantly caused the problem. And now the symptoms are gone. So it's awesome. And it's great. And thank you for telling me that the immune system had gotten stronger to where a sickness came on and really left so quickly, which is great. So something else that comes from this work that we're doing is we're able to, with this work, actually strengthen the immune system. So when another infection comes along, his body was able to beat it much faster than what happened, in his past. So it's awesome. So thank you for sharing that. If there's anything, even though you're not in the camera with us, if there's anything you, Mom, can share with people out there, because I know when I first told you, it sounded good to you that this could work, but if there was anything that you could let anybody else know out there, like from what it was like for him from before to now. And for those who might be skeptical, if this is really true, that this can work when all the different allergy doctors and medicines over the counter and all those things that didn't work for him, and what this has done.
Yeah, I mean, to be honest, I was a bit skeptical too, because, we were raised to know that, you go to the doctor, you get a prescription from the pharmacy, and that should do well. But like I said, throughout his childhood, going to the pharmacy and getting prescriptions and them not working. But I was optimistic because I could tell that just from our initial conversation, you and I, about him, that you were well informed and you had a lot of information to give. So I was open-minded, but I was still a little skeptical in the background, not in the background, but I was a little skeptical. But like he said, it was like a gradual thing. At first it was like, okay, but I was so proud of him because he was determined to do it. He had his schedule down packed. I would just say to him, did you do it? And he'd say, yes, I did it. So he was serious about it. So obviously that it was a lot of value to him to try something. As the time kind of went by and I was like, I'm not buying Kleenex like how I used to. Because he said the 6-pack, I used to go to Costco. It's more than 6-pack, I'm sure. At Costco, Kleenex was always on the grocery list. So, and then of course, there's also the toilet paper. He didn't mention that part. So, you notice little things like that. Like I'm not having to purchase Kleenex as much or, toilet paper as much. And I'm not hearing him coughing in the middle of the night and blowing his nose. Like he can actually get sound sleep. I go and just out of habit, I get up in the middle of the night and kind of check on him. And a lot of times he would be up coughing or blowing his nose. I'd see all the tissue kind of piled up and I'd feel so bad for him. But now it's like I go in there and he's sound asleep peacefully. So I'm very excited about that.
Awesome.
And I'm actually, I'm also excited to at some point get myself and my younger son in, to look at our system and to see what you can find.
Yeah, we'd love to do it.
Things are just hiding in our bodies and we have no idea.
Yeah. And that's true.
Yeah.
Those root causes are commonly missed. What we find with this work is that the root causes that cause the symptoms, a lifetime of symptoms like he had with the coughing and with the sinus problem, is that most often doctors who are the specialists, quote unquote, the specialists in that area, whether it's a sinus doctor or a respiratory physician who's going to examine him, or whether it's a woman with seemingly symptoms connected to a hormone problem, when we can find these different root causes with this method that I work with that are missed with common blood tests missed with common other types of exams that doctors offer people, when those common findings are missed, then they just medicate people, but we can find those hidden causes and get rid of them that you don't know are lurking in the body. When we can get rid of them, the symptoms just disappear. So it's pretty amazing.
Right.
Yeah. So we're happy about that. So thank you for sharing. I appreciate you getting on this call right now. Thank you.